What are the symptoms of iron deficiency anemia? If you've been feeling extra fatigued, you may have been wondering if you might be anemic and have found yourself wondering this very question. If that sounds like you, then you have come to the right place because I am here to answer that question and give you so much more guidance on how to handle all of this in today's video. So let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause Chiropractic, board certified in sports medicine, specialized in clinical nutrition. In this video, we're going to go over the top 10 signs and symptoms of iron deficiency anemia. And let me tell you, fatigue is just one of them. Then we're going to cover the number one reason why you don't want to just start taking iron supplements. There are over 400 different types of anemia, and iron only handles a few of them. And finally, I will be sharing with you 3 keys to boosting your iron levels naturally that doesn't just require you to go out and take iron supplements. Let's dive right on in. Okay, let's get into this right now. What are the top 10 signs and symptoms that might indicate you are deficient or running low in iron? Well, the first one is the most common one, and that's that unusual tiredness or that just constant feeling of fatigue. You know, you could sleep for maybe 10, 12 hours and you still feel like you haven't slept a wink all night long. It doesn't matter what you do, it's just sustained, it's not going away, and you haven't really been able to get any kind of relief from it. That is definitely a potential sign that iron deficiency might be part of what's going on in your body. You see, iron is needed to help our red blood cells attach on to oxygen and be able to transport oxygen all over our body. You could only imagine how exhausted you would feel if you weren't being able to get enough oxygen. You know, for example, I live in Colorado, so I'm a mile high and I go into the mountains on a regular basis, climbing up over 13,000 feet, sometimes higher than that, but I hang out in altitude. And I can tell you, even though I live here at a mile high, when I go up into the mountains, especially when I haven't done it, like after winter happens and I get going again, am I hiking back up to alpine lakes when some of the snow has cleared, it's not as easy to breathe up there. And you find out that you fatigue a lot faster at altitude compared to if you were just at the altitude you're living at currently. Or if you don't live at altitude like I do, if you travel to a higher altitude, you might notice that you're feeling a little bit more sluggish in the first few days when you arrive at that higher altitude, partly because you're trying to grab more oxygen out of thinner air that doesn't have as much readily available for you. And that lack of oxygen can leave you feeling fatigued. So that absolutely is one potential sign of iron deficiency anemia. But as I mentioned, there's like so much more. Another symptom that people may not necessarily have as much awareness around, or another sign that is paleness of your skin. And it's not just your skin, but also like looking at your nail beds and looking at your gums. Iron helps to give red blood cells their coloring, which gives us a little bit of that pink or at least colored hue. If we're lacking the iron, we're not binding the heme the way that we should, which is part of where that coloring comes from. So you may find you're looking a little ghostly, even if you've been hanging out in the sun. Now, guys, this paleness is not something that just shows up with a mild level of iron deficiency anemia. This is more with a moderate or a more severe iron deficiency. And generally, if you are noticing like the inner lower lids of your eyes, your nail beds, your gums, if they're looking more pale, you probably have some of these other signs and symptoms as well. Another symptom, number 3 on our list right now, is shortness of breath. And gosh, in the midst of everything we're dealing with right now, shortness of breath can come on for a multitude of different reasons. If you are not sick, okay, you're not battling some sort of virus or bacterial infection, and you don't have any other issues with like high blood pressure, or a fast heart rate, you've ruled out cardiovascular types of issues. If you're experiencing just like you can't catch your breath or you have shortness of breath, it could potentially be related to an underlying iron deficiency anemia issue. Because again, going back to the fact that iron is what helps your red blood cells bind oxygen. If you don't have enough iron, you're not binding enough oxygen, and so you aren't ever fully getting the oxygen level that you need. You're going to feel short of breath as a result of that. Another symptom that I find a bit more commonly amongst my patients who have been dealing with iron deficiency anemia is feeling a little dizzy or potentially having headaches, or maybe a combination of both. Again, this is partly just because we're not getting enough oxygen to all of the tissues throughout our whole entire body that actually needs oxygen in order to function. Like without it, we're dead, right? So these are other signs that come on when you're not being able to fully saturate all the tissues with oxygen the way you should, because you don't have the main transporter, which is iron. Now, I know I mentioned heart palpitations, or at least a fast heart rate earlier, as being something that could be associated with cardiovascular issues. But if, again, you don't have all these other cardiovascular issues, but all you are noticing is maybe some heart palpitations, or you feel like your heart's fluttering, that can actually be provoked by an underlying iron deficiency type of a problem as well. Part of the reason for this is because the heart is having to work harder to try to pump blood around the body to circulate the oxygen that it's capable of binding to, and it's not meeting the status quo. So the heart has to work harder to try to keep up with the demands of the body. Number 6 on the list would be dry or damaged hair and skin. You see, it's not always about the thyroid either. Unfortunately, all of these symptoms that I'm sharing with you right now are not just associated with an iron deficiency anemia issue either. There are a multitude of different types of health conditions, deficiencies, imbalances, you name it, that could create similar or even sometimes the same presentation. However, if you're dealing with fatigue and you've also noticed that your hair and your skin are not quite looking as healthy as what they used to be, doctors are probably going to look at your thyroid, but one of the other aspects that they will investigate, potentially, is an iron deficiency anemia as well. And again, it's purely because these tissues are not getting oxygenated the way that they should, because you're lacking the ability to bind the oxygen and then transport it throughout the body. In extreme cases of an iron deficiency anemia, that's when you would more than likely see the excess hair loss coming online, not just dry or damaged hair at that point. Number 7 on the list would be swelling and soreness of the tongue or just the mouth in general. Acupuncturists look and examine the tongue all the time. There's so much you can learn about somebody's state of health by looking and examining in the mouth and really at the tongue. So what we will see at times with an iron deficiency is that the tongue actually becomes more swollen, and it can be a little bit sore. Something else you might be experiencing is just dryness in the mouth overall, sometimes cracking in the corners of your mouth, which is so uncomfortable. Those could be associated with that iron deficiency anemia as well. Number 8 would be restless legs. Now, I deal with patients who have restless legs all the time, and believe me, iron is not the only reason why somebody could be experiencing that. There are other different nutrient imbalances and deficiencies that absolutely will bring that on. But it is something, if you're noticing you just can't get comfortable, you can't lay still, your legs seem to want to be fluttering around, that restless sensation could be a factor of not having enough iron stores in the blood as well. Now, number 9 is actually a much less common presentation, but it's still, if it's there, it's present, it could be an underlying iron deficiency problem, or brittle and more like spoon-shaped fingernails. Initially with nails, the first sign that you're going to see is they're going to crack and they're going to become brittle. They're just not as strong as what they used to be. And then ongoing, if this underlying issue is not addressed, then they can take on a spoon-shaped type of appearance where it legitimately looks like a spoon. The inner part of your nail, that center part, actually kind of dips in, while the outer part is almost like, shaped like a spoon. You got edges around the nail. So there's indentations or like one flattening kind of dip in the center part of the nail. That can definitely be associated with iron deficiency anemia. Now, number 10 is actually a little bit of conglomerate of some of the other potential symptoms you might be experiencing. They're not as common, but they are still symptoms that can come about when your iron levels are running low. There is a very bizarre presentation, but it's very classic of when you're lacking a certain nutrient or mineral, in this case, iron, where people get really weird food cravings. And the one that's associated with iron it's been labeled as pica. This is where people will find themselves craving to eat dirt or chalk or paper, sometimes even munching on ice, which many of us may do and not even think anything of. So again, these are not absolute indicators, but if you feel like you've got a hankering for something you wouldn't normally consume, especially when it's not actually food, more than likely you're deficient in some sort of nutrient, mineral, vitamin, you name it. You probably want to figure out what that actually is. Another symptom associated with iron, but again, has a multitude of different underlying causes or contributing factors, would be just feeling depressed, not feeling like your usual happy self, having a hard time getting up out of bed, partly because you have so much fatigue happening as well, but just that mood factor is something that can be seen in iron deficiency anemia. Another one has to do more with the circulation. Cold hands and feet can be associated with iron deficiency anemia. And then the last one has to do more with your immune system, where people who don't have the proper iron reserves in their body actually can be experiencing more infections, more frequent infections. So you just get sick more often compared to what you normally do. Now, that's a hefty list. And you can see it's not always just about fatigue. So if you have a number of these different symptoms, build your case for it potentially being an underlying iron deficiency issue. However, as I've mentioned kind of throughout this segment of the video, there are a multitude of different underlying health conditions or, imbalances, deficiencies, other problems that can create these same symptoms. Here's the thing. We're going to get into why, the number one thing you don't want to do is just go start taking iron supplements. But before I do that, I just want to take a quick reminder and ask you to like this video, click the subscribe button down below, turn your notifications on. That way you don't miss out on a future video. I am regularly publishing videos that have everything to do with you being able to take back control of your health around iron deficiencies, brain health, gut health, anything to do with mental health, you name it. I am publishing videos to help you be able to take back control. So just click the subscribe button, turn the notifications on, and hit the like button for me as well. I appreciate it so greatly. Awesome. Okay, so what is this number one reason why you don't want to just simply start taking iron supplements if you feel like, wow, I had all of those signs and symptoms, Kelly. I know I'm probably iron deficient. I should just go start taking supplements. Why would you not want to do this? Well, as I alluded to in the intro of the video, there are over 400 or so different types of anemia. And not all of those are supported or fixed or balanced out simply by taking iron. For example, one of the other most common diagnoses of an anemia actually has to do with B vitamins, B12 specifically. That's known as pernicious anemia. Pernicious anemia, iron deficiency anemia, they are the two most common. However, as I said, there's a ton of other ones that you all are going to address or handle differently than what you would with a true iron deficiency anemia. The other thing about it is, I know iron is a supplement. So in our brain, we're like, supplements are safe. I could totally use these. It shouldn't be anything that will harm me. However, iron supplements absolutely can come with a pretty good list of potential side effects and health problems that can come about if you do not need to be taking iron. So let's get into what those actually are and why you don't want to just run out and start taking iron. Now, one is kind of more a vanity thing, but when you're taking iron supplements, you do have potential for staining your lovely pearly whites. And there's so many other things that are already working against that. Obviously, that's not a major health issue. However, none of us really want stained teeth. Okay? Another side effect that is not an indication that something went wrong, is just something that occurs when you're taking iron, is that you will notice your stool becomes more black in presentation. There are some healthcare professionals that say that that is actually an indication that the body's utilizing the iron and that you're getting benefit from that. Okay. But just to throw it out there, on the other side of things, black stools normally mean that there's some internal bleeding occurring as well. Not saying that that's coming from iron supplements, but if that's something you already notice and you're not taking iron supplements, that could be a problem. Or If there's some other underlying issue that you don't know anything about because you have no symptoms of it, which believe me, are the last thing to show up, and you start taking iron supplements and there is potentially an internal bleeding issue, which might be part of why you're deficient in iron in the first place, you're actually having an internal bleeding issue, then this could cover it up and you wouldn't notice that sign. That could be an earlier indicator of a bigger problem just by taking those iron supplements. Probably the most common symptom or side effect people will experience when they add iron supplements into the mix is the guts are not very happy. Iron is metal, right? It's not the easiest thing for us to digest, okay? So as a result, you could experience nausea or vomiting as a result of taking iron supplements. You could also experience down lower GI issues, constipation to diarrhea, one extreme to the next. It's not the easiest supplement to actually absorb. It is much better to try to get this from your foods. However, when we do need a supplement with iron, normally everybody is well aware of the GI issues they could be experiencing soon. Another factor that comes on board when you start taking iron is it has the potential to decrease your ability to absorb zinc. Now, zinc affects about 20% of different chemical processes that happen in your body all day long. Like, they do not work if you do not have enough zinc. So this can manifest, zinc deficiencies can manifest in a multitude of different ways. One of the common ones that we have more awareness about now is the more frequent colds and just not getting well as quickly as what you would when you do actually end up being sick. But this also can show up in hair loss or dry, brittle hair, just like having the iron deficiency could. This can also show up in reproductive types of issues, more specifically into infertility or impotence, okay? It can also really affect appetite. So other symptoms that could pop up if iron is actually impacting zinc absorption. There are also several different medications that if you begin taking an iron supplement, it can affect the absorption and utilization of the medications that you've been prescribed. So as always, if you are on a prescription medication already, it is really not the smartest thing to do to go grab any supplement under the sun and just start taking it unless you have full understanding and appreciation of, are there any potential interactions? Whether it's that the supplement actually makes your medication work better, which means you might actually need less of it, or if it negates the ability for the medication to do its job. We want to know these types of scenarios before you start taking supplements. So if you're on a medication, first of all, we need to figure out if you are really iron deficient in the first place, which we'll get into shortly. But then also we need to have a full understanding of, is there any potential risk with adding a supplement into your regimen while currently taking certain prescription medications? A little bit more scary side effect of just taking iron supplements, and this is more of like, we shouldn't self-medicate even though it's a supplement, we feel it's safe. There are some serious potential problems that could come online. This one has to deal with cardiovascular health. You could, if you get high enough levels of iron in your body, you could actually provoke a heart attack. I won't get into all the nitty-gritty details of how that actually works. Just know excess iron in the body can stress the heart to the point that it ends up having a heart attack because of, all kinds of things it does with constricting blood vessels and hardening blood vessels, things you really don't want to have if you want to have a healthy heart. Another scary and not awesome side effect of taking iron supplements is it can, again, when you get too much iron, this is not normal iron levels, guys. Of course, we need iron in the body. This is when you get excess, and this is when you start supplementing without knowing if you truly have an iron problem. You could end up starting to accumulate fluid in your lungs, which that doesn't work very well, okay? Lungs don't work when they have fluid in them. That's classic presentation of pneumonia. Like, the lungs fill up with goo, and now you are having a really hard time being able to oxygenate your blood and get oxygen to every other tissue in the body, which absolutely you need for living. So this is another scary side effect, which is why I really encourage you to know what you're doing before you just start adding in different supplements, especially this iron one that we're focusing in on right now, into your regimen, okay? Know what you're doing. It will save you, potentially, your life. So I'm super curious, did you know that there were that many different kinds of anemia? That it wasn't just all about iron? Let me know your thoughts down in the comments below. Just simply answer that question. I am just always super curious to know what you guys are hearing and knowing. I'm wanting to produce content for you that has a lot of value. So I need your help. I need your feedback. So just drop your answer down in the comments below. That way I see what you guys know, if this was new or not. And I really appreciate that feedback. Okay, guys, what are the 3 keys for improving your iron levels naturally without actually taking iron supplements? And if you do it this way, it actually is safe. You don't really have to worry about those risks with a heart attack or your lungs filling up with fluid, or other scary problems that we didn't even get into. So the number 1 way to do this, the first key, is through eating foods that provide iron to the body and then let the body do the breakdown and the absorption that way. We know that getting our nutrients from our food is the most effective way to be able to accomplish this. Okay. So you can add these foods in and see if you notice you start perking up, then that might also be an indication that, yeah, maybe there was really an iron deficiency that was occurring. So let's go through this list. Iron-rich foods include, of course, red meat. Now, I want to handle the controversy around red meat because we're being told that red meat causes cancer and all kinds of health problems. There is truth in that, but it comes from cows that have been raised conventionally. Cows were not intended to eat grain. When they are eating grain, they are not getting the nutrients they need, which makes them more prone to infection and illness. So that is part why they get injected with antibiotics. And they have to give them more hormones to be able to produce and basically manifest things the way that the farmers are intending them for. Okay. If you eat beef that comes from 100% grass-fed, grass-finished cows, those cows are not cows that are being injected with antibiotics because they don't get sick because they're eating the way that they need to in order for their optimal level of health. And they're also not being injected with hormones. That red meat is 100% different, night and day difference, guys, between conventionally raised red meat. You can eat grass-fed, grass-finished beef and feel comfortable, feel safe, that is not going to provoke health problems. So red meat is very iron-rich. Just make sure you are getting it. If you're going to have cow, okay, that you're getting it from grass-fed, grass-finished cows. The dark meats that come from pork and then also all of our birds, any of our game meats, guys, they are all going to also have good sources, high amounts of iron in them as well. One of the other foods that is really rich in iron are all of our dark leafy green vegetables. So eat a ton of veggies. There's another reason to do it. If you don't like it, figure out a way to sneak them in your food. Like spinach, you can put into anything and really not notice that it's there. So there's not really any excuse to not be eating your dark leafy greens. There are some dried fruits, like raisins and apricots, that are rich in iron as well, but I am going to give you a word of caution when it comes to consuming dried fruits. Oftentimes, you can't get dried fruit unless you're doing it on your own that has not had a boatload of sugar added to it. Now, that's not going to affect this iron issue per se, but it's one of the worst things you could be putting in your body. And then fruits themselves have a lot of naturally occurring sugars, so you just want to not start eating a ton of raisins and apricots to try to boost your iron levels because you can end up provoking other problems just from simply getting too many natural sugars as well. Beans, nuts, and seeds all are great sources for iron as well. And then the ones that I'm not the biggest fan of, but again, very nutrient rich would be your organ meats. Now, if you are somebody who doesn't mind consuming organ meats, then again, I encourage you to make sure they're coming from clean animals that were raised the way God intended them. They're not injected with anything. They're actually, out in the pasture. They're not caged up. They're eating the food that they were intended to. You'll be safe eating those organ meats. So add any or all of those more iron-rich foods into your diet on a regular basis, and within a couple of weeks, see how you're feeling. If you feel like you've perked up, then like I said, maybe that's part of an indication that you were having an issue with iron. But now eating it in your diet, again, is the best way to solve that issue. But we'll come to another thing here. One of the other keys that will help you really know with certainty if this is actually your issue, okay? Now, if you are taking iron, because as I mentioned, it's not the easiest nutrient to really absorb and it does cause a lot of GI stress because of this factor, There are other ways that you can help your body absorb iron, whether it's from your food or you are taking an iron supplement because you already know you have this issue. There are ways that you can help your body absorb that iron more efficiently. So that's key number 2. What do we add in to help the body absorb iron more efficiently? One of the key nutrients for iron absorption is vitamin C. So you can take vitamin C. I take vitamin C on a regular basis just to make sure I'm supporting my immune system and giving my body what it actually needs to function properly. But adding vitamin C rich foods into your diet as well will help your body be able to absorb that iron much more readily. Now, I'm not going to go through the laundry list of foods that actually contain vitamin C. You'll find those in your vegetables and in your fruits. Okay, so eat more greens, eat more veggies. Very much so, go heavy on veggies and just sparingly on fruit would be my take for a whole other reason, which we can get into in a different video. But if you are eating a lot of vegetables, you are also giving your body the ability to then be able to absorb the iron that you're putting in through iron-rich foods. Or like I said, if you're taking an iron supplement, then that's going to help you be able to absorb much more readily. Now, what is the third key way to actually figure all of this out and to boost iron levels safely? Well, it's simply knowing if you actually have an iron deficiency in the first place. If you're not testing, you're guessing, right? As I mentioned, there's like 400 potential different anemias, and majority of them are treated differently. They might have some similarities, but to take care of each and every single one of them, it's unique, just like you are unique. And there's something else that's super interesting about anemias that most people are not talking about. You see, your anemia issue generally is the result of another underlying problem in the body. Anemia is, in my experience, in my mentor's experience, like I've got people that have 50 plus years of experience that they've been sharing with me in all my studies and my research as well. I've got over 16 years of experience that show anemia is not a primary problem. It's the result of something else. So we really want to address whatever this is. If it is an anemia, we have to figure out why you had the anemia in the first place. And again, we don't know that unless we test. Some of the most common reasons why people will actually end up with anemia issue has to do with internal bleeding. So again, if you have iron deficiency anemia and you're taking an iron supplement, does that actually fix this internal bleeding issue that you have? No. But I also know that it's not always internal bleeding. There's other factors. There's different nutrient imbalances and deficiencies. There could be a low-level chronic infection that you have no awareness of because it's so low level you have no symptoms that could be contributing to that. There could be underlying inflammation. There could be a toxicity issue. Like, you name it, there's a multitude of different reasons as to why you could appear anemic. So to really understand and how to address what's going on with you, and even more so, as I mentioned, all those symptoms that have to do with iron deficiency anemia and how they can be caused by so many other issues. Are you really dealing with an iron deficiency problem, or is there something else going on? And if you see that you have an iron deficiency issue, then we also need to figure out what caused that problem. So to get clarity and have certainty and know exactly what you need to be doing, you have to have comprehensive, proper testing done that looks at everything going on in your system at once. And unfortunately, traditional medicine and the standard of care, predominantly it's the standard of care that has locked our traditional medicine into this way of thinking. They're not able to do that all at once. But don't worry, I have so much more information for you on this specific topic and how you can get this done from wherever you are within the United States, and more clarity around that topic by giving you, down below in the description, there's a link to my From Sluggish to Unstoppable. I don't know about you, but if you're feeling a little sluggish, doesn't feeling unstoppable sound like something you would love to have right now? I have written a book about this. It's a simple read. It will not take you much time. And there is a link specifically for you down in the description below to access that free copy of my From Sluggish to Unstoppable ebook that explains exactly the framework behind how do you know with certainty that this is your issue, or how do you know with certainty what was the underlying cause of why you're feeling the way that you do? And then how do you navigate that? How do you address it? How do you reclaim and take back control of your health? I appreciate you guys being here. Hopefully you found this video useful, helpful. So send it on to your friends. Again, don't forget to subscribe, like, and comment. I need to hear from you so I can keep producing content that is going to provide value to you, because that's why I'm doing this. So God bless. Have an amazing day. We'll see you on the next video.